and welcome to the first episode of this new series on behavior therapy, a space where we decode how our thoughts, actions, and emotions shape our lives. Today, we are joined by Ms. Jigyasa Sharma, an experienced psychologist who works with children, couples, and individuals on emotional, behavioral, and psychological challenges. She uses tools like dermatographics to understand brain functioning and personality, and she also trains students in vocational psychology courses. In this episode, we are starting simple. What is behavior therapy and why does it matter? Whether you're a student, parent, teacher, or a teen trying to make sense of your own mind, this conversation is for you. So, ma'am, a lot of us hear the word therapy and a picture lying on a couch talking about our childhood is what we picture in our heads. So, what actually is behavior therapy?
Behavior therapy is first of all, it's a two words. One is a behavior, another one is a therapy. So first of all, I think we all are aware about what the therapy is. It is a like we focus on a, it is like an approach. Therapy is like an approach or a part of a treatment where we focus on the modifying some kind of a cognition part or the behavior part or any kind of a therapy you are taking. So right now we are talking about the behavior therapy. So behavior therapy is a approach where we focus on the maladaptive behavior of the person to replace it with the adaptive one. If we want to modify any kind of a behavior of the person, we need to see that yes, something is wrong with the behavior of the child or behavior of the adult. So during the behavior therapy, we start focusing on that maladaptive behavior of the person and try to replace it and try to modify it with the adaptive behavior, with the better or a, in a general language, we can say that in a good way, good behavior.
And why do therapists focus on behaviors instead of emotions? Like you just said, that maladaptive behaviors. And so, what is the point? Like, if I am someone and I'm feeling a particular emotion, I behave that way. That's how behaviors are defined. It's based on how the other person reacts and about how we feel in a situation. So, why do we focus on behaviors and why is it not connected with emotions?
We need to understand that according to behaviorist, all these researches has been done. We have a different part in psychology. One is the cognition, where the thought process are working, emotions are working, and then the behavior is there, right? So those who have researched on the behavior, which is known as a behaviorists or the theory of behaviorism, they also said that what is behavior? Behavior is that type of an action which is observable and which is learned. So according to the behaviorist, every behavior is a learned behavior. Either you have learned with your own experiences or you have observed someone's behavior, you see the consequences of that behavior, and then you adapt that behavior. So why we are focusing on the behavior of the person during the behavior therapy is thus that there is a behavior which could be learned or observed. Let's understand this with an example. If a mother and a child goes in a market and child would be like, I want to buy this toy, right? And mama was like, you already have this toy at home, why to purchase again? And the boy would be like, no, I want it. He just start shouting and lying on the floor of the shop and start reacting in a very bad way, shouting, crying. So out of the embarrassment, mama bought that toy for the child, right? They come home, everything is normal now. Second time it happens again. Mama and son is going to the market again. Son did a same action, and out of the embarrassment, mama make them to purchase that toy or the whatever the child wants. And now the third time the child is again going to repeat that behavior because he has learned that, okay, the moment I start shouting and moment I start behaving weird, so mama is going to do what I want. This is known as a learned behavior. He has learned from that experiences of two times ki I need to do this action and I'll get what I want. This is a learned behavior. And second is a observed behavior. Maybe the second child or the other child is also present there, and he saw that okay, that child is lying on the floor shouted and crying, and he get what he wants, so I also need to do that and I'll get what I want. That is a observed behavior. So why we are focusing on the behavior during the behavior therapy? Because according to the behaviorist, every behavior may be learned behavior or it is a observed behavior. That's why they are just focusing on the behavior part.
And can behavior therapy help someone who's not diagnosed with anything? Because, as we said, we took an example of a child here. Obviously, he is not suffering from any kind of mental health issue or any kind of clinical problem, right? So, does it help someone who's not diagnosed with anything?
Yes, it is. Behavior therapy is also very helpful for the parents who are just doing a genuine or a general parenting or a good parenting for the child, right? I tell you this case. Here, the child is not having any kind of a issue. A child is not having any kind of a mental illness or any kind of a abnormalities of a problem. He just learned one kind of a behavior and he just repeating that behavior. So just to modify, this is known as a maladaptive behavior. What is maladaptive behavior? The behavior which is not suitable according to the environment or according to the scenarios, right? And we need to replace this maladaptive behavior with the adaptive one. So we need to understand what type of a techniques we can use to change this type of a behavior. So during the behavior therapy, we can learn different general techniques as well to modify any behavior where the person is not having any kind of a issue. Still those techniques could be used on that person, on them, or on that person. Or if somebody is having any issue, anxiety or depression or any type of a issue, then specific techniques are also there to use the behavior technique or the behavior therapy on that person. So yes, it can use, and it is very helpful for the person who is not having any issue, and it could be applied on anyone.
Why is behavior therapy helpful for especially students and teenagers and young people?
Yeah, because there is a lots of exposure in the today's era, right? The child is having phone at the age of 5 6 year old. He's using the phone all the time. Even the if the child is much younger, 1 2 years old, mama is giving the phone, and the child is watching all the rhymes and the cartoons all the time. Screen time is there a lot, right? If the students and the adolescents or the younger children, they are getting exposed with lots of things which should not be exposed in an early age, right? Internet is also there, lots of things are there. So behavior therapy is very helpful for the students, for the younger generation, and for the parents to treat them, right? Because there is a lots of techniques like reinforcement is there, shaping is there, generalization is there. Students and the younger generation is very much capable of understanding and observing their own behavior, so they can maintain it, they can having a self control ability to do so things, right? So yes, it is very required, because there is a lots of things our students are doing and the younger generation is doing lots of things just in the pressure of peer pressure is there. My friend is doing this kind of activity, so I am also going to do so. My friend is having that part, so they are just fighting. My friend is having this toy or this video game, so they are fighting at home to get that video game. So these are all that stubbornness, aggression is lots of aggression, stubbornness is there, just because of lots of exposure of internet, tv screen, mobile screen. So that's why behavior therapy is very required for this generation, because parents can understand how to replace their behavior with a good one, with the adaptive one. And the generation is also very much capable of understanding their own behavior, change their own behavior, maintain that changed behavior as well. So it is very important for today's generation.
Doesn't that mean getting controlled? Because imagine I have some kind of behavior and I've been sitting with someone and talking about my behaviors and I'm to change, expected to change. And even my family or anyone, who would be aware about this, they would expect to see change like as soon as we get over with 2 or 3 sessions. And I feel like I am being forced to change.
No, no, no. It is not anything forced thing to apply you, or we are not putting any kind of a forced activity on you. Right? It is not, we are not going to control you, we are not going to change you, your emotions or your thought process. You, like if you are taking your example or any young generation, we need to make them understand that as well, that this behavior is wrong, right? You need to understand that this type of behavior could be applicable for one time, two time, but not for the rest of the life. And if we couldn't, fix the things in today's time, so it will definitely going to, they are going to regret it in the future, that yes, my this behavior is wrong, which leads to this type of action reactions, then leads to not suitable, and you are not getting the suitable environment for yourself, which leads to lots of problems as well. It could directly affects your emotions, it could directly affect your cognitive process as well. So it is not a controlling process, it is not that we are just forcefully putting something on you. It is just a way to make you and make the generation understand that yes, this is wrong, this behavior is wrong, this behavior is not accepted by the environment or by the situation. You need to understand where you are wrong, and you need to replace it with the good one, or you need to approach it, yes, how you can make it good, how you can amend it. And yes, things are not possible going to be good in a 1 minute or in any 3 4 sessions or something. It will take time, but once it comes with the habit, once it comes with the practice, you are going to be comfortable with that thing as well. Then you are not going to be feel like controlled or forcefully putting things on you. So no, it is not like controlling you at all.
When if I think of it, everyone has bad behaviors, and then they are talked about it and they're told that it's wrong, and it's turned into a good behavior or the correct one, I would
Hmm.
say. So is it not like that all the behaviors would be same, and if everyone, let's assume that everyone takes this behavior therapy, and now is there any uniqueness left in a person or in their personality? Because if everyone's behaviors improve and they become a good person, then what will be the, differentiating factor between people?
Okay, yeah, I can understand your question. See, we are not going to change you at all. We are not going to change your personality, your hidden traits, your talents, the way you speak, the way you talk, the way you like, the way you do things. No, we are not doing anything like this. We are just correcting the wrong behavior. We are just correcting the maladaptive behavior. We are just correcting ki no, this is not good, this type of behavior is not acceptable by the society or by the environment or by the situation. We are just correcting that particular behavior and replace it with the good one. Overall, we are not changing your personality. Overall, we are not changing your thought pattern, your talents, the way you are. You just be the way you are, but we are just correcting any wrong behavior with a good one. It is not like that we have changed the whole personality. Yes, your perception would change if we come with the behavior therapy, or if we come with any kind of a therapy. How you're perceiving the information from the environment would be changed. Your perception is going to be changed, but it is going to be changed in a positive manner, right? It is going to be changed in a better manner. Nobody wants that, okay, my child shouts in a crowd, or my child starts behaving weird in front of the guest or in front of the people. Nobody would like that, right? Even you as a generation, or as a student, or as a daughter, you cannot like bear that your mother is going to shout in front of your friends or in front of your classmates. You cannot bear that. So this is obviously, this behavior of the mother is also wrong if if she is shouting in front of you, in front of your friends, or in front of your colleagues or anyone. So we are just replacing that shouting behavior, which is not good, which is not appropriate according to the situation. So we are just correcting that wrong behavior with the appropriate one. We are not going to change your personality, we are not going to change your thought process, we are not going to change your the way you are, the way you think. We are just correcting the maladaptive behavior with the adaptive one, with the changed better perception, good perception and good thinking.
Does behavior therapy help in emotional problems like anxiety or heartbreak as well?
Yeah, because when I take it, when I say that, it changes the perception as well, right? I am into that sadness and I am not doing anything just because of having a breakup. I recently have a breakup and I'm just all day I'm just lying down. All day I'm not doing anything, no hygiene concern, not going out, not following my routine, not going school or my office or anything. I'm not following anything. I'm just lying on the bed whole day because of repetition of that thought that I am having a breakup, I don't have anyone, full of sadness, grief, full of emotions, emotional distresses there. But once I understand ki, okay, let's do something, let's do some action, let's do some kind of a behavior which maybe affects my thought process, or which maybe affects my day in a better way, right? So if somebody is having anxiety issues, yes, it is connected with the your thought process as well. If somebody is having heartbreak, yes, it is connected with your thought process, your emotional regulation as well. Here we can also apply other therapies as well with the behavioral therapy. We can apply one more than one therapy simultaneously if somebody is having this kind of approach. So yes, CBT could be applicable here, DBT could be applicable here, where the cognition process is working, we are just changing their distortions, cognitive distortions, and we are changing their thought process and the belief. That person is into that belief that I don't have anyone, I will die single, or I nobody's here to support me, nobody's here to love me. So just changing that cognitive distortions and a negative thought pattern as well. And with the behavior therapy, we can modify and shape their behavior in a better way with such kind of activities which gives them pleasure, which gives them enjoyment the way they were having before. So yes, it is applicable on the anxiety issues or any heartbreaks or any other basic issues, with the attachment of other therapies as well, with the inclusion of other therapies as well.
What does a typical session look like? Because, like, is it awkward? Or for someone like me, I think it will be very comfortable because I can talk to a stranger about everything I'm feeling. But for most of the people, and especially in our generation, we can't even talk to our friends about how we feel. So, talking to a stranger, knowing that we are paying them to help us out, and our parents might have,
Hmm.
arranged this. What
Hmm.
if they tell our parents, and how would they judge us? So, what exactly is this feeling, and how can a youngster, overcome this?
Yeah. See, how does the therapy looks like? It is just like a normal conversation, right? It is not like the picture you are having of lying on the couch and just telling what thoughts are going on. No, it is just a normal conversation on table and chair, that's it, right? Yes, we talk about the thoughts, we talk about the emotions, we just try to understand what the person is feeling. Talking about the judgments, and when the parents are includes, they come up with that. So yes, confidentiality part is always here. It is also one of our ethics of confidentiality, right? If the child is adult, if the person is adult and he don't want to share any of their conversation or any of their issues with anyone, either their parents, friends, family, so confidentiality clause is here. We cannot share any kind of information with anyone without the consent of the person, without the consent of the client, right? It is just a normal conversation where, as a therapist, we try to understand what the person is going on, Lots of understanding, empathetical part is here, right? Second thing, if the person is not able to talk, or he has a feeling of the person is going to judge me, what the therapist is going to think about me, etc., etc., he's not comfortable of talking to the client, talking to the therapist as well. So yes, sometimes it happens, but when the session starts, we as a therapist try to make them comfortable. Rapport building is there. As a therapist, we don't have any kind of a biased thought process. We don't have any biased nature. We are not judgmental at all. We are just understanding what you are going through, and we are here to help. We are here to listen to you. We are here because in today's, as you said, that you are not comfortable to talk to your friends as well, and 90% of the generation is like that. They are not comfortable to talking to someone because of that feeling that people are going to judge me, or the people are start behaving weird with me. But here, some people feels light and feels comfortable because they know that I'm not their friend, or I'm not someone who is going to judge them, who's going to biased with them. They understand that, people understand that yes, I'm coming to the therapist, I get a professional help, and I'll definitely get my solutions here. Because we need to make that kind of an environment, that rapport building, make the person comfortable, and we are not going to judge them at all. There is a full part of a confidentiality. We are not going to share what the things are going on into the session without the consent of the person. So this is not something you get scared of. Even you feel happy, you feel light, because in the outer world you are not going to share anything with anyone because of having distortion of being judged, or what people are going to think about me. Here I am the person who is actually listening to you, who is actually present to help you. So people feel comfortable to talk to us. People feel happy कि finally I got someone who is not going to judge me, and I can tell my whole story. I can talk to the therapist about anything because he is not going to judge me. Not any kind of a judgmentals and biasness is there. So in short, they are feel comfortable, and if somebody is coming for therapy, you should maybe feel weird or maybe feel scared in the initial time, in the initial minutes, but the moment you enter the scenarios, when you start talking, things become actually very very comfortable. So this is not something you get scared of or you feel like awkward or something.
We just talked about biasness, that you can't be biased and you won't be biased. But if we take a situation, for example, me and maybe a friend of mine, we had a fallout
Hmm.
and we are seeing the same therapist.
Hmm.
And maybe we are not aware, or even if we are, and if at least the therapist would be aware that, okay, I have these two clients and they have the situation which is about each other. So
Hmm.
is there any point of time when you will take sides, when you will see that, okay, this person was right in this situation, or maybe this person was wrong, but okay, even if they were wrong, they were too sensitive, so they can't handle it. So in such situation, first of all, does that happen? And is it possible that it happens? And if you are in such situation, what exactly goes on in a therapist's mind?
Okay. Usually it doesn't happen. It doesn't happen. But let's take a hypothetical situation. It happens. Two friends are coming to the same therapist. So, see, as I said that as a therapist, we can't be biased. One thing. Usually, second thing is that we always talk about the client centric part. What is the client centric part? Where the client is thinking about themselves, thinking about the problem and the solutions by themselves. We are just helping them, telling them what is right, what is wrong, right? We can give them one scenario, or we can give them just a little guidance, and rest the client is thinking what the things are going on, what could be the possible way out of going that, what could be the possible solutions. So whenever you are coming for the therapy, always understand that it is a collaborative approach of client as well as therapist. When you are coming to the therapy, you are not would be like, yeah, I'm just sitting now, all the things would be done by my therapist, I'm not going to do anything. No, it doesn't happen. It is a collaborative approach. It is a therapeutic relationship between the client and the therapist. So collaboratively you have to do everything: finding out the solution, finding out the problems, doing the things, setting up the goals, doing the interventions, doing the activities. You have to do together everything. Hypothetically, if the two friends are coming and obviously they are totally opposite of others, they are totally against each other. So as a therapist would always support and always tell what is right, what is wrong. They are not going to be biased at all. They are not going to be judgmental at all. If you are wrong, so they are not would be like, no Kaustubhi, you are wrong, this is your fault, that is, your friend is truly fine. ऐसा नहीं होता. It doesn't happen at all. They will make you realize by yourself only कि okay, where were you, what you think, why it happens, what happened, what were the situation, why you guys follow, what was the reason of your fight, what was the reason of the conflict, how it could be started, what could be the possible solutions at that time, what could be the possible scenario, what could be the parallel scenario as well. So there is a lots of questionings and realizing by the customer, realizing by the client ki yes, this could happen, this could also happen, this could be a situation, and I can maybe react in that particular way. Your therapist is not going to say ki you are wrong, you are right. They are just going to help you to realize by yourself that what is right and what is wrong. So be comfortable. I'll make sure that there is no kind of a judgments and no kind of a biasness at all, that the therapist is supporting one of the friend and other one not, and they are saying, you are right, you are right, you are wrong, you are wrong. Not at all. They are just make you realize, and they are just helping you to understand the scenario and what can be the possible scenarios as well, what could be the possible situation happened that time. So this is the answer. They are not going to be biased and judgmental. And this activity would be done to the other friend as well. It is not like they are just putting all the attention to you. They are doing the same activity to the other person, to the other friend as well, so that he or she realizes ki, okay, maybe this could be the situation, or I can act in that particular way, or I can find out the solution, or I can do it in a parallel situation as well. So this activity would be done on the same on the both friends by the same therapist, and they are not going to be biased with anyone, not going to be judgmental with anyone.
Right. And my last question for today would be that what's the one thing you tell someone who's thinking that I don't need therapy and I can handle it all alone, which we can see in most of the millennials and boomers maybe and the
Mhm.
previous generations?
One word is that try once. You should try once for the therapy, not for the therapist, so just come and talk to the professional one, same, who is not going to judge you, who is not going to biased with you, who are just giving you the unbiased answers, or who are just giving you the unbiased solutions. So handling alone is not a solution. It will make, maybe it will make more conflicts for you. Try once for the professional help, try once for the therapy, and it is definitely going to be very very helpful for you. And एक से भले दो, अगर आप, if you are trying to handle it alone, your therapist will come as a friend and will try to handle it with you and with the situation as well. So they should definitely try once to talk to the professional help, or to the talk to the professional person, and rest the history, everything would be done.
That's it for today's episode. Thank you so much, ma'am, for turning in. And if this sparked your curiosity, stick around because we are just getting started. Next time, we are diving into the different types of behavior therapy and how each one plays a unique role in healing and growth. Until then, stay kind to your mind.